Good morning.
Good morning. Thank you for having me. This is a beautiful building and it's wonderful to be here. My name is Adrielle Walker. I'm a licensed clinical social worker and a resident of Fair Oaks. It's a pleasure to be here. I am a therapist at Kaiser. I've worked for Kaiser for 5 years. We are entering in our 5th week of a strike, trying to pressure Kaiser to do the right thing and provide ethical, legal, and safe mental health care for its members. Again, we've been on strike. This is our 5th week. Prior to the strike, Kaiser offered us an economic package that we accepted, but they did not offer anything to address our increasing concerns about members' access to safe, ethical, and timely mental health care, and so we hit the lines. And I say that because this is not about money. This is about safe mental health care. I work with children and adolescents in our intensive outpatient program, which means I see children who have been hospitalized psychiatrically because they are suicidal, have attempted to take their lives, are injuring themselves intentionally to deal with stress, overwhelm, and emotional pain. These children and their families come to me straight out of the hospital. I usually see them in the first day, 1, 2, or 3 after coming out of the hospital. It is not unusual for me to have to look at these families and tell them, I have a group that you can start next week. I cannot see you again in person for 2, 3, 4, once we hit December, easily 4 or 5 weeks. So these children are coming to me after suicide attempts. They've been hospitalized, often have not received any mental health care in their lives. The family has never received any mental health support in their lives. Let me put you in this group, but I cannot see your child again face to face, over video, one-on-one for 3, 4, or 5 weeks, and it's unacceptable. It doesn't align with any standard of care for mental health care. Kaiser continues to expand its reach in this county, in this state, and they have been unable to provide ethical, safe, and now legal care for any of its members. Leans on county systems, community systems to provide the care that they are not providing. It is time for them to step up. Our ask is that you lean on our state government to both enforce the laws that we have in place and to get them back to the bargaining table, because what we're bargaining over is a system that takes care of its members. This is not about money. It's not about administrative time, what they've been telling you and the public. This is about creating a sustainable system that takes care of its members. We are in a mental health crisis, particularly with children and adolescents. I see them every single day, and there isn't a single one that I can provide evidence-based, ethical, and legal care for. So again, please, please urge our state government to enforce the law and get Kaiser to create a system that works. Thank you so much. This is beautiful. Thank you for having me here.
Good morning. Excuse me. My name is Jenny Butera, and I'm a licensed clinical marriage family therapist. I work at the Downtown Behavioral Health Clinic right here on G Street as a general outpatient psychotherapist. And after 11 years with Kaiser, I have yet to manage a manageable caseload. I am on strike with my colleagues throughout Northern California, still fighting for patient access. It is no new phenomenon that my schedule cannot accommodate the patients on my caseload. When our strike began on August 15th, my next appointment for anybody that was available was not until mid-October. That's always been the status quo, though. The most common report I hear each session from a patient is how much life happened between that appointment and the previous appointment, to the point that the patient can't even recall what they had talked about the last session. All the homework, goals, and coping skills discussed in the previous session is now old news, and now new stressors are the focus. It's as if I've been having to start all over again, trying to gain trust with the patient, convincing them that I'm not abandoning them, that I really am available, that there's some connectedness and still some therapeutic alliance to do some effective goals, to work on some effective goals. But how does trust get established when a patient waits 2 to 3 months to even meet me, and then I tell them it'll be 2 months for me to see them again? Already they don't trust me, they don't trust the system. And I often hear, what do I have to say, that I'm suicidal to get any help? After 3 contracts since I was hired in 2011, not one has yet seriously addressed the issue of poor patient access. Now there is finally a new law, SB 221, that directly addresses patient access, dictating that return appointments as well as new appointments are to be offered within 10 days. Despite this law in place as of July 1st, Kaiser's negotiations with us therapists have stalled in what is now the 5th week of our strike over patient access. Kaiser will publicly assert that the contract impasse is about wages. It is not, I can tell you that, just like Adrielle did. What we care about most is patient access and having workable, reasonable, and ethical caseloads. In fact, it is Kaiser's very own required yearly compliance training that I must attest to, committing to act with utmost integrity, take responsibility for my actions, and to pursue my work in an honest and ethical manner. In compliance with the principles of responsibility, Kaiser's policies and procedures, and applicable federal, state, and local laws. After years of Kaiser promising to fix the access problem, now they're saying it's a national shortage of therapists. And yet in my clinic right over there on G Street, we went from 1 manager to 4 within the last 2 years. How is it that they've got no problem hiring managers who are licensed therapists but won't replace the therapist positions? At least 2 of those managers were taken from the general therapist population, leaving unfulfilled 2 vacancies of therapists who would actually see patients. Those positions, along with others vacated by therapists who have simply left Kaiser, are now unfulfilled because Kaiser tells us they don't have the budget to backfill. But they tell you it's a national shortage. Either way, I'm asking that you consider mental health as important as physical health. You have an agenda item today involving an amendment to increase money for the ER director's position to meet the increased compliance requirements within the ER system. Please urge Kaiser, the governor, and the Department of Health and Human Services to direct more money to hire more therapists for Kaiser and to comply with Kaiser's very own stated core values and ethics. Thank you.
Hello.
Good morning.
Thank you for allowing me an opportunity to speak. I'm going to just reference my notes so I can stay on track.
Go ahead.
My name is Lisa Epstein. I'm a licensed clinical social worker in the Department of Psychiatry for Kaiser Permanente in Sacramento. And I work with adults in our general outpatient program, and I've worked for Kaiser for 21 years. I'm here today to ask you to please consider calling on Governor Newsom to take immediate action and to consider the current state of affairs in the departments of psychiatry and emergency. 5 weeks ago, 2,000 mental health clinicians from Kaiser in Northern California went on an open-ended strike because we could no longer, in good conscience, continue to practice ethically in Kaiser's broken mental health system. Be assured, we are not on strike for wage increases as Kaiser would have the public think. We have gone without pay for 5 weeks and are still on strike today because, and I struggle here because I fear that I will not be able to impress upon you with mere words how bad the situation really is in our department. We remain on strike because Kaiser has, for years, flagrantly ignored taking responsibility for its substandard psychiatric services, and things have finally reached a tipping point. Currently, patients wait 3 months for an initial appointment. Once seen, they wait anywhere from 6 to 8 to 10 weeks for a return appointment. Therapists see patients on average 6 times a year. The industry standards of care are every 1 to 2 weeks. This greater frequency and consistency is impossible at Kaiser. It's an egregious violation of ethical practice. As therapists, we are sworn to a code of ethics. As employees of Kaiser, we sign sworn attestations every year that we will adhere to and abide by Kaiser's own code of ethics. Sadly, not only are there daily ethical violations in care, but now with the passing of Senate Bill 221, which went into effect on the 1st of July, there are also daily legal violations. SB 221 states that patients have the right to be seen every 10 days. With a 90-day wait for an initial appointment when patients are distressed, suicidal,
crisis, and then a 45 to 60-day wait between return appointments, patients are not receiving the care they need and deserve and are now legally entitled to. And that is abuse. One of Kaiser's code of ethics is what they call a speak up culture. Well, we have been speaking up for years about the lack of access and proper patient care to no avail. Now we are shouting. We are on the longest mental health strike in history. Kaiser can do better by its patients. Kaiser needs to hire more staff and fix its broken system, and we need help now. Patients are in trouble now. We can't wait for the slow wheels of bureaucracy to turn. You would never subject your family or loved ones to this type of care. You would never allow your partner, your child, your parent, or even yourselves to receive this kind of care.
Lisa, I need to ask you to conclude if you could.
I ask you to call on Governor Newsom, Department of Managed Health Care in the state of California to do their job. It's time for Kaiser to pull its weight.
Thank you.